The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today, we're going to be talking about President Donald Trump's tariffs and their potential impact on healthcare costs and the healthcare system. So I've gotten a number of inquiries from readers on the potential impact of the new and potential tariffs on healthcare. To be honest, the picture is not terribly clear in the short term or the long term yet, but certainly I've come to the conclusion that current and future tariffs could demonstrably impact costs in healthcare. We'll take our regular 3 breaks today and break it up in 4 parts. Let's get right to it here. I wanted to start out a bit with a little background on my views on tariffs. So I came to political maturity under Ronald Reagan. I was a staunch free market conservative. Like Reagan, I am a believer in free trade. The statistics over the years would say that every country really becomes wealthier when there are no or low tariffs in a global free marketplace. Like Reagan, too, I do believe tariffs can have a small role in ensuring other nations act fairly in the global marketplace and to protect national security in certain industries. So that's certainly not unreasonable. But by any measure, I think Donald Trump's tariff plan is not well thought out and his tariffs clearly excessive. And I really feel like his tariffs are indeed arbitrary. They hearken back to the mercantilism of the 16th to the 18th century, as well as the Smoot-Hawley era and a tariff act that played some minor role in furthering the Great Depression. The tariffs won't accomplish what Donald Trump wants and perhaps hurt the economy in the meantime. I think he should use his bully pulpit and his usually great marketing skills to really look at more practical ways to revitalize manufacturing in certain other sectors, and then to carefully target perhaps tariffs to national security in certain industries. So with that admonition about my views on tariffs, let's talk about first America's healthcare import reliance. So America is heavily reliant on imports for medical supplies, devices, finished pharmaceuticals, and active pharmaceutical ingredients that are used to manufacture pharmaceuticals domestically. So these 4 groups, again, are core to what we're going to be talking about: medical supplies, medical devices, complete or finished pharmaceuticals, and then active pharmaceutical ingredients that are used in our domestic production to manufacture other finished pharmaceuticals. Here are some just quick facts from various sources about our heavy reliance on imports for healthcare in these areas. First, the U.S. relies heavily on imports for pharmaceuticals, medical equipment or devices, and supplies. In 2019, almost 40% of pharmaceutical and medical equipment imports came from Europe, while 20% originated in Asia. Second, the U.S. imported over $300 billion of medical devices and pharmaceutical products in 2024. Third, China, Mexico, Canada, and India all are important in terms of supporting U.S. healthcare supplies, devices, and drugs. Fourth, about 70% of medical devices are manufactured exclusively outside the U.S. Fifth, the U.S. currently imports 75% of its essential medicines. Sixth, India produces about half of the generic drugs the U.S. imports. Seventh, China supplies 80% of U.S. APIs, what I talked about earlier as active pharmaceutical ingredients. Eighth, more than 500 generic drugs rely on one country's APIs, including treatment for diabetes and heart conditions, as well as antibiotics. And last, the European Union supplied 127 billion worth of high-value branded medicines, not generics, but branded medicines, making it America's largest pharmaceutical importer, about 60% of total pharmaceutical imports, because again, brand drugs are so much more expensive. So, volume wise, the European Union is not the biggest, but they are the biggest because of the price of branded imported drugs. So, with that discussion about my views and background on tariffs and America's healthcare import reliance, we're going to take our first break and we'll come back to get further into what tariffs are in force right now. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Donald Trump's tariffs and their impact on healthcare costs in the healthcare system. So I promised to talk about what is in force now and what is proposed. While a baseline tariff is in effect for most countries, the Trump administration did forestall for 90 days imposition of his reciprocal tariffs. If those are eventually put in place, much greater tariffs would be enforced. Heightened tariffs are in force already for China and a few other countries. So far, the tariffs from the Trump administration clearly impact medical supplies and devices. The vast majority of supplies and much of our devices, as I said earlier, are imported from various countries. Leading exporters of such supplies and devices include China, India, Canada, and Mexico. Finished pharmaceuticals are so far exempt from tariffs, but the administration recently issued an investigation into the national security implications of our reliance on pharmaceutical imports. This is a precursor to tariffs, and Trump has said he intends to institute tariffs on pharmaceuticals very soon. As noted above, America also imports vast amounts of APIs, active pharmaceutical ingredients again. Some of these APIs were exempt from tariffs for now, but not all APIs are exempt, especially ingredients used in over-the-counter medications. Remaining APIs could be tariffed based on the announced national security investigation and what Trump has indicated. So, in summary, supplies and devices are already tariffed. Some active pharmaceutical ingredients are already tariffed. And all drugs and APIs could eventually be tariffed under Donald Trump's plans. So, what are the impacts that we expect from these tariffs on the costs in the healthcare system? Well, in short, tariffs on all these areas will impact healthcare costs demonstrably, which are already rising 6 to 8% per year in the employer sector and Medicare over the past couple of years. In general, there are some stockpiles of supplies and pharmaceutical ingredients in the United States. But these supplies will eventually be exhausted. And to ensure ongoing supplies, drug makers, suppliers, hospitals, and other providers will need to immediately determine a path forward. Long-term contracts tend to protect many healthcare providers in the short term, But over time, supply chain entities will pass on tariff costs to providers. Health plan and pharmacy benefit managers, too, have discussed existing protections and contracts related to price hikes. But as providers see their cost hikes increase, so will plans and PBMs. Providers will demand increases due to these costs, and it is only a matter of time before health plans and PBMs see those increases, and in time, those increased premiums throughout the United States healthcare system. Hospitals will especially see tariffs effects as they have a major dependence on supplies, devices, drugs, and bigger equipment. While most physicians are less dependent, independent practices are already financially strained, and tariffs could yet drive more independents out of business. Hospitals could see increases over time of as much as 15% to their costs. Drug costs nationwide could also increase by as much as 15%. Costs for prescription drugs could rise by an average of around $600 per year per household in the United States. It is hard to say exactly what the tariffs will do to overall costs, but consider that the increase in costs was already projected to be about 8% in 2025, and perhaps to some degree 8% or a little less annually thereafter. With hospitals and drugs accounting for between 40% and half of healthcare expenditures, you can see how overall costs will accelerate. Even if the current annual trends relax a bit in terms of cost increases, we could very easily see healthcare percentage increases well into the double digits going into 2026 or perhaps 2027 if all of these very high tariffs go into effect. With that, we'll take our second break here, and we'll come back to talk a little more about real impacts on generics and potentially on shortages of drugs and other medical supplies. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Donald Trump's tariffs and what the impact could be on the healthcare system. Let's talk a little bit now about the big fear of the impact of these tariffs on generics. So, as we know, generics are low-cost drugs. They have heavy competition. And brand drugs are usually very low competition or only one drug out there, and they are usually very expensive. Well, generic drugs account for about 90% of all prescribed medications in the US, and generics are extremely narrow margin. Generic manufacturers simply cannot absorb tariff costs within their small margin business. This could send generic prices up dramatically and also compromise the financial health of these generic manufacturers. Overall, as well, tariffs will likely pull dollars from overall research and development by manufacturers, principally brand manufacturers. Let's also talk about the real threat of shortages from the standpoint of drugs, as well as other supplies and equipment and devices. Not only could tariffs increase costs in the healthcare system, but they could lead to additional shortages. We already have some very pronounced shortages in the drug and other areas in the healthcare system today. We have seen supply and drug shortages already in America, and tariffs could exacerbate this. Worldwide supply chains could contract due to the tariffs. China, too, could hold the U.S. healthcare system hostage as we are heavily reliant on importation of active pharmaceutical ingredients. Hospital groups have gone on record worrying that certain drugs could critically be in short supply. Those include cancer drugs, cardiovascular disease drugs, immunosuppressive drugs, and antibiotic medications. We are also very worried about the potential impact on quality and access. Higher costs and supply chain disruptions can make it more difficult for hospitals and patients to access essential medical devices and supplies. Another big worry is the impact on quality as providers forego maintenance and replacement of large scale manufactured components in critical devices and equipment. Thus, access to care and the quality of care could suffer greatly. With that, we'll take our last break. And when we come back, we'll talk a little bit about Trump's case for onshoring, why it likely won't work, and conclude. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Donald Trump's tariffs and their impact on costs in the U.S. healthcare system. So, Donald Trump's case for the tariff is really about onshoring manufacturing and creating more manufacturing jobs. And in part, he wants to do this with drug manufacturing and medical supply manufacturing and healthcare device manufacturing. It's not a terrible idea. I just happen to think there are better ways to go about it. So again, the Trump administration is not wrong about the national security implications of being heavily reliant on imports for our healthcare system either, especially when you think about the fact that China, an authoritarian regime, has so much hold on our healthcare system. But the blunt force approach of tariffs that Trump is using to drive onshoring of medical supply, device, and drug manufacturing is likely not the best, or at least it will not succeed alone. Supply chains for healthcare supplies, devices, and drugs are complex. Unraveling the supply chain and bringing most or all of it onshore would take a great deal of time. In the meantime, there are massive repercussions that will occur. Showing just how difficult onshoring is, the COVID pandemic did lead to greater domestic manufacturing of medical supplies, perhaps the simplest of things to establish. But since the pandemic subsided, many of these entities have closed up shop, given logistical and margin issues. So that's just a word of caution in the need to go slow and find better ways of onshoring, given the national security interests that ultimately Trump is right about. So what do we conclude here about all this? Well, healthcare costs are already spiraling out of control due to utilization coming out of the COVID pandemic, inflation and price hikes, and a surge in the use of weight loss, specialty, and cancer drugs. In 2025, as I noted, we are seeing at least an 8% increase in healthcare costs. And these kind of trends will continue in future years. Tariffs threaten to further heighten the increases, which could undoubtedly erode the benefits and coverage Americans rely on. Trump's tariffs will be a disaster for the healthcare system and coverage, in short. With that, we'll conclude this edition of the Healthcare Labyrinth podcast. We'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.